female contraception that protects against unwanted pregnancies is called the diaphragm. The dome is made of either latex or silicone and is soft and shallow. The primary function is to prevent the sperm from coming in contact with the egg. The combination of spermicidal cream or gel with the diaphragm is enough to provide adequate protection. The diaphragm has a 98% success rate when used correctly. So, we are going to watch about the how to insert a diaphragm.
Method 1. Inserting a diaphragm properly. First is wash your hands.
Wash your hands with warm water and soap. Always touch and handle the diaphragm with clean hands. If you need to empty your bladder, do this before washing your hands.
Step 2. Inspect the diaphragm before use.
Gently stretch the diaphragm at the area of the rim on all sides. This helps ensure that there are no holes or tears in the device. You can also check for tears or holes by pouring water inside.
Step 3. Apply spermicidal cream on the diaphragm.
Add at least a tablespoon of spermicidal cream inside the dome of the diaphragm. Spread the spermicide over the rim and dome with your finger.
Step 4. Find a comfortable position to insert your diaphragm.
You can insert the diaphragm by standing with one foot resting on a chair, lying down with knees bent and feet apart, or squatting down. Once you have found the comfortable position, locate your cervix, the opening that leads to your uterus. Step 5. Insert your diaphragm up to 6 hours before intercourse. Make sure the front rim is tucked under the pubic bone and that the diaphragm covers the cervix snugly. If it feels loose, then you might have the wrong size. Step 6. Wash your hands after the diaphragm has been placed. Washing your hands will remove bodily fluids and spermicide and should always be done before and after inserting or removing a diaphragm.
Finally, add more spermicide if needed.
You should also add more spermicide if you insert your diaphragm hours before having intercourse. Most spermicide products come in a tube with an applicator tip. Simply insert the applicator as far as you can without discomfort.
Method 2. Caring for and removing your diaphragm. First is wash your hands.
Always wash your hands before and after inserting or removing a diaphragm. Proper hygiene helps maintain your diaphragm longer and prevents vaginal infections. Step 2. Wait for at least 6 hours after intercourse before you remove the diaphragm. You should not leave the diaphragm in for more than 24 hours. This is unhygienic and can lead to serious complications, such as toxic shock syndrome.
Step 3. Locate and remove the diaphragm.
Be careful not to tear a hole in the diaphragm with your fingernails. Hook your finger firmly on the upper rim and break the suction. Step 4. Wash the diaphragm with warm water and mild soap. Always clean the diaphragm after use to remove bodily fluids and spermicide. Do not use strong and perfumed soaps because it may weaken the rubber. Step 5. Store your diaphragm in a container in a cool, dry place. With proper care, the diaphragm can last up to 2 years. This includes storing it in its container and avoiding exposure to hot or wet environment. Finally, replace the device after 1 to 2 years or upon the advice of your healthcare provider. If the diaphragm breaks or tears before it is time to replace it, contact your healthcare provider and ask for a new device. If you have any doubt about the integrity of the device, it is better not to use it.
Method 3. Selecting the right diaphragm. First is choose the right diaphragm.
Choosing the right type of diaphragm is important. Currently there are 3 types to choose from: arching spring, flat spring and latex.
Step 2. Choose the correct fit.
If you use poorly fitted diaphragms, it can slip during intercourse and lead to pregnancy. You can get fitted by your doctor, who can also help you choose the proper one. The procedure takes around 10 to 20 minutes and you may experience some discomfort. Step 3. Know when it is safe to use a diaphragm. If you are not a good candidate for this type of contraception method, other alternatives are available. Consult your doctor about the different contraceptive methods available for you. Finally, know the advantages and disadvantages of using a diaphragm. Knowing the pros and cons of using a diaphragm is vital and allows you to choose the proper contraceptive method for you. Diaphragms do not produce hormonal-related side effects.
We hope it is useful to you. Please subscribe to our channel to upskill yourself.